Um, the patients in uh, the unit in which we did this trial, from which we recruited the nursing staff, medical staff, and things like that, within 24 to 48 hours, they were coming up to me and saying, "Is that doctor on a pill?" And I was actually surprised because they didn't know this was happening. Okay. And the answer was, well, yes. And they're able to say to me, "Is he on an SSRI?" And I was saying, yes, probably. You know, the thing was they were observing the staff in a way that the staff don't observe them
Hmm.
anymore. They're operating on theory. They're operating on the basis of, well, if you aren't well after, a week or two, we have to wait for up to 6 weeks to, and then you'll actually recover. The patients could spot what happens to people and had learned. They had an expertise we didn't have
Hmm.
based on observing people on these pills. And the same thing happens in prisons.
Hmm.
I was interviewing a man recently who's in jail. He'd been on an SSRI and things went wrong. And he was able to say to me, the other prisoners can pick out who is on an SSRI and who
Hmm.
isn't without being told. So,
And can they do that very soon after they start the SSRI?
well, they can tell people who are on SS. I mean, first of all, the patients could tell within roughly 24 to 48 hours after the person had been, after the nurse or maybe the doctor had begun taking an SSRI. They
Yeah.
could tell, yes, we can see that this person's on these drugs. And actually, based on what they alerted me to, I've become able to spot
Hmm.
people who are
Hmm.
on
Hmm.
SSRIs pretty
So
quickly as
basically, it
well.
sounds like what you're saying here is that human beings, by observing each other in face-to-face real-world interactions, they can tell when someone's on an SSRI within a day or two of them starting to take it, even if the clinical manifestations of the potential antidepressant effect haven't shown up yet, because those often take weeks to manifest.
The antidepressant effect is there from the start.
Mm,
It's either a good effect, it's what Arthur Carlson said. Look, there's going to be a chill out effect,
yeah, yeah.
or there's not. And
Oh,
people can say within 1 or 2 days, yeah, this drug is doing a useful thing for me, and I can see how it could be helpful. Or they can say, no, I haven't getting anything out of this. Or
oh,
the effect, maybe I feel a chill effect, but it isn't something that I like.
I see. So this a standard story, a common story that I've read about and heard about in academic settings about SSRIs, it goes like this. Um, on average, the antidepressant effects of SSRIs in those people for whom that effect will manifest can take several weeks to manifest. And this has something to do with, the slow time course of neuroplastic changes being induced. And that's why it takes a few weeks for the antidepressants to show up when they do show up. You're saying that effects manifest much sooner than that.
It's a bit like alcohol or nicotine or benzodiazepines or whatever. The effect of these drugs is fairly obvious fairly quickly.
Mm-hmm.
And it can be a good effect. And it's not the thing that cures you. Most people who get SSRI drugs, okay, are people who have a problem that's going to resolve spontaneously anyway.
Hmm.
So the cure, so-called, is not being brought about by the pill. The pill just makes things more comfortable for a period of time, or
Mm,
else it makes things a lot worse.
I see.
It can do either.
I see. So
Uh,
something in your life is happening. It's making you sad, basically. But that thing will usually resolve. That stimulus will usually go away. And the SSRI, in some cases, can make that intervening period more bearable. But it's actually the stimulus in your life going away that will actually cause your sadness to resolve, basically. And the SSRI can be a tool to make that intervening period more bearable, basically.
yes, exactly. And let me bring out a thing here, which comes back to the issue about does it make sense to pay heed to what you tell me is happening to you on the pill, or should we just go by what the RCTs say?
Mm-hmm,
Okay.
mm-hmm,
And the randomized control trials of these drugs compared these drugs to placebo. And they show that over a period of 6 to 8 weeks, yes, there are some people who seem to recover, but it may take about 6 weeks. Well, yes, the recovery can take about 6 weeks, but that doesn't mean that it's anything to do with the acute action of the SSRI. But the
Mm,
other point that comes into play here is people look at the data from these RCTs and say, well, the effect of the SSRIs is pretty weak. They only just about beat uh, 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 the um, the
placebo.
the placebo effect.
Yeah.
And people can go on to say, well, maybe most of the effect of the SSRI group of drugs is a placebo effect. Okay, now there is a sense in which that's right, which is that the part of the placebo effect is just the natural recovery effect.
Yeah. And I
Okay,
imagine it also has to
but
do with the fact that, if you're entering a situation where you're going to see a doctor, you know that you're being cared for by someone who's paying attention to you. Like all of those things have a sort of what you might call a natural healing component because, you're not just off on your own. You're being cared for.
yeah, not quite, not quite. No, if you don't go to a doctor at all
Hmm.
and you get well after 8, 10, 12 weeks or whatever, you're more resilient and less likely to get ill again in as the future. So natural healing works by natural healing.
Hmm.